Welcome, everybody, and welcome to HURT Healthcast number 4. I'm Dr. Fred Liss, president of HURT, and we're lucky today to have one of our partners from Signature Orthopedics, Dr. Buck Smith, who's a foot and ankle specialist and a traumatologist, to join us and talk some medicine, talk about patient access, and some of the important things that are affecting their market in the St. Louis area. We have the great fortune to meet today with Dr. Buck Smith from Signature Orthopedics. Dr. Smith is a foot and ankle and trauma surgeon in St. Louis, and he is a partner with us with his practice with HURT. And we just wanted to have a conversation today to talk a little bit about the Signature practice, the marketplace, whatever is interesting to Dr. Smith in ways that I think relate to maybe private healthcare, private practice versus the big marketplace, et cetera. So, Dr. Smith, maybe you can just give us a little hello and intro about yourself, anything you want to tell us about you first, and I'll do the same afterwards.
Yeah, hello. I'm Buck Smith. Happy to be here talking about the HURT app and my practice and how it relates to my practice. I am a board certified orthopedic surgeon. I've been in practice for about 5 years. I primarily do foot and ankle, elective care, and then trauma care, generalized trauma care, and about a 50-50 ratio in terms of the patients that I treat. I've been in St. Louis. I did St. Louis. I went to WashU in St. Louis for undergrad, and then spent 9 years in Alabama training at UAB for residency and med school, and then did a fellowship in foot and ankle in Denver for a year.
Great. Wow. What a great history. My name is Fred Liss. I am the president of HURT. I'm an orthopedic surgeon, upper extremity. I practiced at Rothman Orthopedics in Philadelphia for many years and retired from clinical practice. So, I'm looking at you and feeling how young you look and seeing myself and seeing how old I look. It's kind of scary to me, but yeah, it's great to have you here, and it's really great to partner with Signature. And I'm curious, as a guy who lived his life in private practice, I know that the concept of access to one's practice is super important now. I mean, more than ever. I'm curious how you feel the immediate access piece that we're using with the HURT app per se is helpful in the marketplace where you are, because St. Louis is an interesting market. There are a lot of big healthcare systems out there. So how does this impact your practice, and how do you view it?
Yeah, for sure. I think that St. Louis is like any big city where you're the primary big city in your state. It's going to have a high density of orthopedic surgeons. We have a very, very wide catchment area of 3-4 hours away where patients who are in rural areas come up to St. Louis to get their care. And in a situation like that, where you've got competition, things like the HURT app and allowing instant access are going to be helpful to differentiate you from some of the other places. I think we get a lot of our patients through the ER and a lot of our patients through urgent care. And I know that one of the missions of the HURT app is to try to decrease some of those frivolous visits. There's certainly places, there are certainly injuries in situations where the ER and urgent care are going to be your best bet. But, I saw the stat on the webpage that 90% of those visits could probably be avoided. And I think that's probably somewhere accurate, probably hard to quantify, but it's somewhere in the, more than 75% of ER visits, and certainly way more than 75% of the time spent in the ER, because it usually is very, very long. I mean, the hospital across our street has a 8 to 12 hour wait for non-emergent things, that a lot of that could be handled with with the HURT app. Being, the first group or one of the first groups in our area to be on that platform is a differentiator for us. There's a whole lot of small private practice groups in St. Louis, and as the years go on, there's all these projections about decreasing numbers of orthopedic surgeons relative to the population, and all this, projected 5,000 orthopedic surgeon shortage in a decade or something like that. Mm-hmm. we have combated that with physician extenders like PAs and mid levels and things like that to just give patients access. But things like the Hurt app allow the use of technology to see whether you even need to see an orthopedic surgeon, because
Right.
all the orthopedic surgeons, at least in our practice, once you've been there for a couple of years, your practice schedule is basically full. Like you don't have spaces for add-on patients. So if someone has an urgent problem or an acute problem, if we can avoid the entire physician encounter because someone says, "Oh, that's just a bruise, you'll be fine," you probably can just follow up your primary care doctor. Then that's going to be helpful for access for patients who really do need it as well.
Yeah, I think you make really several great points. A couple I want to go back to. One is that, the vast majority of musculoskeletal injured patients that arrive in an emergency room do not need to be there. And actually, believe it or not, there have been several studies about that, and it is north
Is
of
that right?
90%. Yeah, so like people, what they really mean is that people come into the ER and they get sent out with a sling and told to see an orthopedic surgeon, which we don't think is good healthcare. It costs about $3,000 a pop on average across the U.S. But
Jeez.
as a trauma surgeon, I'm certain that you understand the complete chaos that occurs in ERs when it's filled with unnecessary visitors. When you have a trauma patient come in and it displaces those people who are waiting for a long time, but also may distract the ER staff. So we think that there's a couple of reasons why an immediate access tool like Hurt works from an ER standpoint. One is it avoids a lot of headache for the patients, their whole family. When they're stressed out, they get immediate feedback on what it is they have going on. And then they get reassured, hey, I don't need to go to ER, but hey, maybe you need to go to Signature's walk-in clinic, or, maybe you need to just wait until the middle of next week. This is a routine problem. And having that immediate human access is really important. But the ER situation, we also think that it really does help unload ERs. And in the long run, we're doing patients a service by giving them a quick answer to what is really going on and getting them where they need to go. And our punchline is, getting patients the right treatment at the right place in the right time. We think that's super important. But you also mentioned, in private practice and a competitive edge. What made you go into private practice? I'm curious. I'm a private practice guy all the way, and have been that way my entire career. So, what are the things that, having trained at a pedigreed places that you've been, what led you to go into private practice?
Yeah, it's a great question. The things that I wanted autonomy, basically, it really boils down to when I'm counseling residents and things about how they should frame the question. There are lots of big advantages to being in a huge system. Like in our city, the big system is Mercy or SSM or Barnes Jewish, where WashU is. There's three big systems. And there are certainly big advantages to being in those systems. But you just don't have the control that I have every day to do what I want, when I want to do it, make complete decisions on hiring and firing my staff, when I want to do surgery. Do I want to open up extra slots and see extra patients, or do I want to start taking Friday afternoons off? The kinds of surgeries that I do, do I want privileges at this hospital, or do I want to switch over to this surgery center? Do I want the practice to buy a CT scan? Do I want to expand our physical therapy? Like all of the, we have a physicians meeting here in about 45 minutes. It's all the owners and our non-shareholders, and we get together and talk about all of the topics every other month that really go into running a small business. There are certainly, I kind of tell some of the residents, there's a much bigger ceiling of the compensation you could get by being in private practice. It's pretty much unlimited, but there's also a much lower floor because private practice is a small business. And if you don't want to deal with the headache of running a business or of having that risk, if you will, then private practice isn't for you. But I enjoy the aspects of being a small business owner. And I certainly think it's extraordinarily important in the medical landscape, as there's loads of evidence that hospital consolidation, there's a recent report out, hospital consolidation drastically increases cost like months later. Like As soon as your slowly failing hospital gets gobbled up by a big player, all of a sudden everything you used to do is 21% more expensive or whatever, you know? So it's
Right.
independent practices help drive down costs, no doubt. It's not questionable. And I think the whole system, at least in orthopedics, the whole system is somewhat reliant on private practices remaining private, which is kind of
Right.
interesting because over time, private practice participation has gone way down. When you started, private practice was commonplace. And now that we're starting, we're having to compete against all these big players. And it's been really hard to convince, new graduates, new fellowship graduates to join us instead of join the big hospital across the street. So it's kind of a dying breed, so to speak. But we think it's very, very important going forward.
Well, it's interesting that you bring that up. You don't know this about me, but I'm very heavily involved in political advocacy for patient and private practice matters, physician-owned hospitals, physician autonomy, patient care. These are all really important things, patient-centered care. And one of the reasons why I love private practice, in addition to some of the things you said about autonomy, is it gives us the ability to remain satisfied with what we're doing, which turns into a much happier doctor who gives much happier care and therefore happier patients. So, in other words, you're right. I think the balance of care is really super important. I think right now it's about 70% of United States physicians are owned by larger systems or private equity. And you're right, the balance of private practice is essential to the health of our healthcare system. And there's a lot of work, including what we do at HURT, that's fighting to bring that back to the table. So, for example, when we first started HURT, one of the big examples we gave about patient delay in care was an Achilles tendon rupture. We saw a
Yeah,
tremendous number of these people playing pickleball, and you probably see it as a foot and ankle guy.
every single
And
day.
so, yeah, so you'd get somebody who would go into an ER. They thought they sprained their ankle and they had an Achilles rupture, and they're told to follow up in 3 weeks. And they come into your office, and their Achilles is retracted up, halfway up their calf, and it's a much more complicated surgery. And me, as a hand surgeon, was biceps tendon ruptures. We realized that there's this great divide that's pushed patients away from their doctors. And the idea of navigating immediately is really, really for the benefit of the patient. It is good for us as doctors. So, I'm glad to hear your sensitivity about the importance of private practice, because I think it is essential to the saving of our healthcare system. That's where HURT came from. We were tired of seeing patients get pushed around. And then I don't know how many times you see this, but people come to me and they say, "Oh, Dr. Liss, you have no idea how hard it was to get in to see you." And for me, I never say no, or I never did. Somebody called in, my day ended when the last patient was seen. So private practice tends to have that edge. And I can tell you, I've looked at some of the comments that patients make about you. I can tell you're very dedicated to your patients. And I will tell you that while there are really great doctors in, academic care, et cetera. I mean, I was a private-demic guy. I think the edge that we get as private practitioners is we own it. We own it. Our outcomes are very important to the outcome of our practice, and that aligns the patient goals with our goals. So I really love that, what you said, and I think that's really super important. Um, when
Yeah.
you get a chance to see patients that have come in off of an immediate, say, navigation, and it's more timely, can you reflect on the difference of how it feels when you have that difficult patient who comes in and they've just been to the primary care, they've had the wrong study, they didn't have an MRI or whatever? How does the HURT model or the immediate navigation model feel to you as a physician who sometimes see things not go as smoothly as you would like?
Yeah. And really, I think the Achilles is a great example. An ankle fracture is a great example, but basically a, um, a traumatic injury that needs surgical management, and for the vast majority of orthopedics, is one that is best fixed within 2 to 3 weeks. So if you think about an Achilles rupture, there's some pretty clear data that patients who have surgery prior to 21 days before their injury, or 21 days after their injury, versus those patients who are in the subacute category more than 6 weeks, And so there's like a little area where in between 3 and 6, it may not make too much of a difference, but that's the sort of categories they bundle them in is, do you fix it right away or do you fix it in a subacute fashion? That the subacute patients do way worse. Same thing with ankle fractures, same thing with peroneal tendon tears, same thing with tibant ruptures, like anything that is traumatic almost always needs to be fixed in the first couple weeks. It's not usually immediate. Like if you've got like a Liss Frank midfoot injury or something, you can't fix that right away. It swells too much. But so it's not that necessarily the patient who has the injury needs surgery the next day, but the quicker they get to the treating physician, the person who is deciding whether they do or don't need surgery, the quicker that decision can be made and the quicker they can get on a surgery schedule. Because I think that some things that get lost when you're talking private or we're talking primary care doctors or hospital administrators or whatever, basically when you're speaking to a non-surgeon, they don't understand that if the patient sees you at day 11, that does not mean they're having surgery day 11, because day 11 might be a Thursday and your next OR day is Tuesday, because you really only operate on the days you operate. You can't cancel all of clinic because someone came in with with an injury, and the whole idea of block time and all that. I mean, you understand it as an orthopedic surgeon. If you don't have block time, you can't really do the case. So the quicker the patient has the injury, the clock is ticking. It's not emergent. It's not, even urgent, but within the first 5 to 7 days for the vast majority of orthopedic injuries, some injuries are way worse, displaced scaphoid or something, there's some things that need immediate reduction, but usually that's something higher energy and they're going to be in the ER because it's a car accident or they fell off a roof or something. But for the standard, sort of cold trauma, we call it, you want to get to see the person making the decision of whether, yes, this needs surgery, yes, or no, it doesn't, within about a week. And that gives them about a week or so to get advanced imaging if indicated. Oh, I need a CT scan for your Liss Frank, or, oh, I need an MRI because your Achilles is torn or whatever, and then get on the surgery schedule and get it fixed. So it is very clear. It is demonstrated in basically every single, literature search on acute trauma that you have a 2 or 3 week window before things get much harder. Things start healing in the wrong spot, or retraction, like a distal biceps. It's really hard to pull that down if it's been 4 weeks.
Yeah.
So it is key with the HERT app, getting that access quicker, or just getting someone to tell the patient, hey, your problem is not that big of a deal. We don't need to rush. And that gives them peace of mind. Or, hey, I'm concerned that, you can't dorsiflex, you've got a foot drop or your tiband's torn.
You were talking about timely care, and I really truly believe that a big part of healing has to do with really reassuring patients. I know that from having seen some of the comments about you. You're a caring physician, and I think private practice facilitates that. Not that academia or otherwise can't do it, but I think when we get patients seen in a timely fashion, not only are those factors about the science and the biochemistry of healing important, but also the emotional factor of really being able to look somebody in the eye, put your hand on their shoulder, and tell them that it's going to be okay. Here are the things that you need to do. That's huge. And we have really been sensitized on at our company, and the founders and I have really, really worked hard to fight that battle of that wedge that's between patients and doctors. We just don't want our patients to have to wait, but we also have a bandwidth of our own, to see a certain number of people. But as you said, for you, if somebody called in and they had an Achilles rupture, you're going to see that person unless you got to get, somewhere that's really primary, say, for your family. So I think in general, the idea of immediate care is not because everybody wants to have, immediate access. They do. Patients want, people want to pick up their phone and get what they want. We're used to the Amazon approach now.
Yeah.
But it really is good healthcare. I mean, getting them connected so they know that they've got a place to go. They don't have to worry. They know they're doing the right thing for their child or themselves is really huge. So I think for the science.
I think it's a great point. I think I've been fortunate to not have any severe injuries myself, but I can imagine a scenario where I did. And I think for me, type A type of personality, it'd be hard to sleep for 2 or 3 or 4 days while you're waiting to hear from a nurse or going, okay, when do I start pestering these people? Because I haven't heard anything. And sure, my wrist sure does hurt or whatever. Um, there's a very strong link between anxiety and pain and outcomes. There's
Absolutely.
one of my mentors at UAB, Dr. Ponce, had multiple studies that proved that like one of the biggest links for like the number of opioids that the patient took post-operative from shoulder surgery, as well as their ultimate like patient-reported outcomes, was catastrophic thinking,
Right.
which is kind of a medicalese term, but it basically is the idea that, okay, I sprained my ankle and I haven't heard from my doctor and I'm worried about it. And now I'm going to need surgery and it's going to get infected and I'm going to lose my leg and I'm going to lose my job. And then my boyfriend's going to dump me. It's like this catastrophic spiral.
That's right.
And with the Hurt app, you break the cycle before it even starts spinning because you get connected within a couple minutes and someone says, "Oh, that's an ankle sprain. You're gonna be fine." It's not necessarily always medical advice. We say that's not likely to need surgery. You can follow up in a week or two. It's not super urgent, and it just kind of pours a little water on the fire of anxiety, which Americans in general over time have become more and more anxious every year. So I think the Hurt app is an app to help quell some of that anxiety associated with medicine. And then, like you said, the cost component, instead of potentially $3,000 ER bill,
Hmm.
it quells the anxiety of how much is this going to cost because it's free for the patient.
Yeah. So, okay, let's shift gears a little bit, and I'd like you to tell me a little bit about Signature and what makes it so outstanding. And I say that not to just tee it up for you to go at it, but I can tell you that when we did our investigation, when we look into clients, potential clients, we want to work with good practices. We know that Signature is a super high quality practice. What distinguishes your group? Some of the things that you feel really make Signature as great as we see them to be.
Yeah, I think it starts with leadership. I think for the younger physicians, having the leaders that we have, both physician leaders and the executive leaders, um, makes you feel good about the direction of the company. Doctors can come and go. The practice has been there since 1974, so it's had longevity. We see private practice groups every single year dissolve or get bought up. One of our primary competitors just got bought by a hospital system a couple weeks ago. That just got announced. So that's happening constantly. And those hospitals have tried, and private equity has tried to acquire our group. And I'm sure that some of the physicians in the leadership group may have thought at some point that would have been helpful or beneficial for them individually. But the group at large has always had an independence. They've always been in South County, the particular area of St. Louis, and they've been there so long that we are taking care of patients who came here. I've put in ankle replacements in 60-year-olds who saw my partner when they were 30, or their kids have been treated at the group forever. So it's almost like a familial sort of woven into the fabric of South County. It's been in the same spot. We have some green carpet that looks like it's been there since 1974 in some of our rooms too. So the nostalgic effect when some of the patients walk in, but it's a practice that has just stood the test of time. It doesn't fold or sell out to a private equity, because there are lots of private practices that are no longer private because private equity comes in and starts pulling some strings and increasing costs and doing all that. So for me, it really goes down to leadership, longevity, and then relationships. I think we employ like over 100 people when you include all the support staff and nurses and athletic trainers and call room and all that. And they know that they've got a stable job, that we're going to be there and we're going to be providing excellent care. And everyone's just got a really strong work ethic, like you kind of described. It's unique to the private practice model and the private practice physician to want to work hard for their patients, to want to be available to sort of enjoy the ins and outs of running a practice while also seeing lots of patients. And we're a high volume place, so we see a lot of patients each day. 300 or 400 patients walk through our door every single day, 5 days a week. With the Hurt app, that might be increasing, but yeah. So that's the things that drew me to Signature, and having been for 5 years in the group, it's what makes me wake up every morning and feel really good about the decision that I made, and feel good about that.
Well, it's interesting. So, I work on the business side with your company, and what I noticed that was really exceptional was the authenticity of all of your staff. And having been in, I mean, really warm, authentic people, and having been in healthcare for a long time, one can tell, a physician can tell very rapidly when you work with a practice whether the leadership is leading from the right place or not. And I can
Yep.
totally concur with you on our feelings about Signature. That kind of mentality of really being ingrained in the community is huge. It's really the way medicine was developed in this country. Doctors were independent. They owned hospitals. They ran hospitals. They took care of families for generations. Yeah, those are really brilliant observations, and I couldn't agree with you more about it. So I'm just curious, do you have any other things that you would want to talk about? Any things that are on your mind that you'd like to share or discuss or share with us?
No, I mean, I think that when Kayla asked me if I would be interested, one of the things, well, I of course love chit chatting about medicine, but one of the things I wanted to do is to be a part of the promotion of the Herd app, because the app is great, the idea is great. I think the your guys' leadership from the when it was first presented to us, one of the nice things that this Herd is sort of a good example of this is that Signature is always looking to innovate. We're always, willing to make changes that we think are going to be better. We're not just kind of sitting there and stagnating. But it is only as good as the adoption of the app. If a patient uses it and it's fantastic for that one patient, how is it scalable? How can we get the word out? How do we get more patients use it? You download and you just have them. Um, but the Hurt app you kind of need to have before you get hurt. Like you need to kind of get it, or not necessarily need to, but it's easier to have it accessible prior to the emotions and hysterics of, oh, grandma just fell and her knee is swollen or whatever. So it's kind of like getting the message out, getting patients to download it, and it being on everyone's phone, and then the access problem is fixed. So I think that promoting the app is something that excited me about doing the podcast today.
It's funny. When I was at an Ortho Forum meeting as a vendor, rolling the app out to different people, and there was a guy doing little mini podcasts coming around, and he interviewed Brett Miller, our founder, and me. And when I finished the podcast, I just looked in the camera and I said, "Get hurt before you get hurt." And that's true. I mean, I think it's really
Yeah.
super important for people to have a plan. And this is a tool that really makes your practice, it
Yep.
makes the Signature Group accessible in a way that there is no access any other way. I mean, it is just so good for human beings. And we're really glad that you see that. And by the way, the marketing piece, I mean, we work with your marketing team and we have a very highly developed marketing staff as well. And we're very laser focused on doing things like podcasts to hear your thoughts and see how you're reflecting on it, what the needs are, and to try to help. So we're not just a drop it off like they do with Epic and everybody has a heart attack because they don't know how to use it. We are really dedicated on our side to make sure that we do promote it in your market together with you and continue to do that into the future. And also to hear what your innovative ideas are, because we're willing to adapt our software platform to the things that you see specifically that you need as well. And that's really an important part of the ongoing conversation that we have with our clients. So I really appreciate your insights. And I thank you very much for taking time out of your busy schedule. I hope you have a cool time at the game tonight. Drink lots of water.
Yeah, we need a
I didn't real
rainstorm to come in.
I didn't realize it was so hot out there, that there was such a hot spell going on. But that's rugged. I'm sure your kids are going to just love it.
Yeah.
Love it. But anyway, thank you so much for your
And
time.
nice meeting you.
Yeah, it's been a pleasure. And going forward, if there are ideas that you have, please, you have my cell, text me, call me. We're always open. I know Kayla has been very accessible for us, and we want to continue to build the relationship.
Awesome. Thank you.
Pleasure. Have fun. Thank you so much, Dr. Smith. This was really an enjoyable conversation. Hearing your insights has been fantastic, and I think your observations are brilliant. We are really grateful to have you and Signature as partners, and we look forward to not only what the future brings for our partnership, but we also remind the listeners to stay tuned and listen for future podcasts from Healthcast, because there are always new innovations coming, and we're excited to improve patient care across this country. Thank you for your time.